I'm Kristen from CSC Insurance. And if anyone has questions throughout the presentation, please just stop me. It is pretty lengthy. I think from start to finish, it's about 20 minutes. So I will try to make it as exciting and short as possible. Tons of information on Paylocity that if you want additional information, you'll be able to find that online. This is just a brief overview. My information is here, and then a couple of my team members, their information is here, as well as Nicole and Julie. So if you want to take down any contact information to reach out to us later on, it is available, and I'll share this after the presentation as well. Open enrollment, like Nicole said, is the time of year that you get to make elections, make changes to your benefits if you're on coverage already. So if you want to add a spouse, elect coverage, waive coverage, this would be the time to do that. Anything outside of open enrollment, you would need a qualified life event in order to make a change. All full-time employees are eligible, as well as your kids. Spouses are only permitted on medical coverage if they do not get offered healthcare through their own employer. You will have to complete a form confirming that they don't get coverage offered at their own employer if you are going to enroll your spouse on Dawn's plan. You will have to make elections through Paylocity and confirm or waive your coverage no matter what happens. If you don't want to make any changes, you still have to go in and confirm. The timeline is March 2nd through March 12th. It will be ending on March 12th, so make sure you get your elections in. And evidence of insurability forms are only required for anyone electing life insurance over the guaranteed issue amount. And the short-term, long-term disability options are a true open enrollment, which means you do not have to complete an evidence of insurability form for those. So take advantage of that. That is a one-time opportunity as we're changing carriers from Principal to Sun Life. As I mentioned, we're in open enrollment. You can make mid-year enrollment changes if you have a qualified life event. And then anyone that's a new hire would be able to come on and make changes as they're hired. This is a list of what a qualified life event is, or a change in status. These are some common things. A change in a spouse's plan. So if your spouse would lose coverage, that opens up the opportunity for you to make changes on your plan. If you have a baby, you get married, you get divorced. Those are common things to make changes mid-year. There are notices and disclosures that are provided online at paylocity.com. So just make sure you're looking at those. Some good information. A lot of it is legal jargon, but the COBRA notice explains how you would continue coverage if you were to ever leave Dawn's. That is an important one. You do have the right to request a written copy of these if you email Nicole or Julie. I'll briefly explain some of the changes for 2021, and that's April of this year until March of next year. And the 3 medical plans that are currently being offered will remain the same. So if you're currently on the plan, those 3 plans are exactly the same, no changes, but there is a change in what your contribution or what comes out of your paycheck, pre-tax, payroll deducted, will be changing this year, and I'll explain in a little bit. Dental and vision will be changing from Principal to UPMC. You will get a new ID card regardless of what your medical coverage is. You'll have 2 UPMC cards, so keep a lookout for that in the mail. Flexible spending account will be changing from Task to Ameriflex. Again, you will be getting a new ID card in the mail for that as well. And both of those cards would be coming right around April 1st. When open enrollment ends, we'll be making those changes with both carriers. So that would trigger that card to be mailed out to you. And then all the other benefits, life, disability, critical illness, and accident will be changing from Principal to Sun Life. And I'll talk about a few of those changes in a little bit. So the reason for the price increase on medical coverage, because that is the only change that you're going to see in terms of price increase or what's coming out of your paycheck. And healthcare costs continue to rise year after year, and Dawn's Appliances has been very, very generous in the past couple of years where they've taken on the increase and not had to pass it on to the employee. So Unfortunately, this was a year that there was a significant increase in the cost, and we did our due diligence and made sure that there was no other carrier, no other plan option that was more affordable or better coverage. And we went through all the options. We start back in October, starting to explore options for you and the rest of the employees at Dawn. So we're confident that this was the best option based on what was going on within Dawn's appliances and the claims. And one of the biggest factors is prescription drug prices and the specialty drugs and the rise on specialty drugs. I think they talk about big pharma, and this is talked about through the election and always talked about a topic in the news and how healthcare costs are rising. But in your particular case, the reason for the big increase was specialty drugs. And we're doing everything we can to mitigate that in the future so we don't see an increase moving on. So. Like I mentioned, all 3 plans that you currently have with Dawn's are going to remain the same. So this is a pretty brief snapshot of what is currently being offered. There are benefit summaries that are in Paylocity if you want to take a look at all the details. Each benefit summary has about 6 pages. So again, pretty brief snapshot. But on the left, there's 3 plans. On the left-hand side, the PPO 250, this is going to cover the most. So the least coming out of pocket when you go to the doctors, but the most coming out of your paycheck. So you're going to pay upfront for little out of pocket whenever you go to the doctor. So this is maybe somebody that uses the doctor a lot would utilize this plan. Both of these plans are with the UPMC Premium Network. So that also is a significant difference from this 3rd plan. And I'll talk about that in a minute. The EPO 1000 is a middle of the road plan, so pretty safe bet on whether you may or may not use your coverage. And the last plan is the highest deductible, so the most coming out of your pocket when you go to the doctors, but the least coming out of your paycheck. So someone might choose this plan if you rarely go to the doctors. You may just need to go to like an annual checkup or get a couple of prescriptions. The prescriptions are identical across all 3 plans. The copays are the same. The drugs that are available are the same within all 3 plans. But again, as I mentioned, this plan has a different network. It's called My Care Advantage, and I'll explain some of the differences on that network. This does have 2 levels within this plan. There's a level 1, and that determines how much is out of pocket in level 1 and level 2. If you want to go to those providers or hospitals or facilities, then they're going to double what your out of pocket is. So this one requires a little bit of work in determining which provider is in which level of this network. So a little bit more complicated, but it is the least expensive and still really low copays if you'll have to go to the doctors. $20 for a PCP and $40 for specialists or in urgent care. So I'm sorry, $75 for an urgent care, but really low copays if you still need to go to the doctors and don't need to reach that deductible. So I'll just explain the deductible versus copays quickly. 2 different buckets of out-of-pocket expenses for you and your family members. So there's either a deductible or a copay. And deductibles are these as this first line here, and they only apply to certain services. So inpatient hospital, outpatient hospital, diagnostics, and emergency room. So if you've been seen at the emergency room, you have any treatments there, they're going to charge towards that deductible. This is one time through the plan year. So if you've reached this threshold, you're done paying for the year in any of those services. All copays are going to be pretty much the rest of your plan. Anything that you would go to the doctors, get a prescription for is going to be a copay, and those continue throughout the year. There is a maximum. It's pretty high. It's pretty unlikely that you would ever get to that maximum. If you ever reach it though, you will be covered 100% for anything that you have out of pocket. So I encourage you to look online at all 3 benefit summaries if you really need to dive a little bit deeper, or you can reach out to our team at CSC or Nicole and Julie. As I mentioned, the first 2 plans are on the premium network. So pretty small print, but again, This is going to go by county, and this is on Paylocity's website if you want to pull this up and reference it. But all UPMC hospitals are going to be in the premium network, as well as all independent hospitals within the Western Pennsylvania area. You can see in outside of Pennsylvania, in New York, Ohio, and West Virginia, there's a significant amount of facilities and hospitals. All the providers are going to be found online, so you'll want to go to upmchealthplan.com in order to find a provider or check a urgent care or facility that's going to be in your area. But another way, if you don't have online capability, you can always call member services and ask them which provider or hospital would be in the premium or the MyCare Advantage network. And it's going to tell you the website here as well. The MyCare Advantage network is broken down into 2 levels, and this is just a listing of the hospitals and facilities. So level 1 is going to be listed here, and level 2 is the second page and half of this first. So in this area, the 2 hospitals that are not in level 1 are going to be Jefferson Hospital and Ohio Valley. So those are pretty close to where some of your employees are located and their homes are located. So those 2 are significant. I know MedExpress is not in level 1, they're also in level 2. So those would be 2 or a couple of facilities and hospitals that would be a change from the premium network if you're in one of those plans right now. And then again, if you want to look up any providers that would be in MyCare Advantage, you'd have to go online or call member services. UPMC still has all of the same great value-added services. One of the greatest things, in my opinion, is UPMC Anywhere Care. There is an app for it. It's its own app, but it allows you to FaceTime with a doctor. It is a virtual healthcare visit, and it's sort of like going to urgent care, except virtually. So you don't have to sit in a waiting room with a bunch of other sick people. You can do it virtually online from anywhere. It's 24/7, 365 days a year. And it's only, it's a fraction of what the urgent care is. I believe on most of the plans, it's about $5. From now until April 20th, or I should say it's continuing until April 20th, UPMC has decided to continue to waive any cost sharing for any virtual visit, as well as any COVID related deductible service. So that will continue until April 20th. They keep extending it based on Governor Wolf's orders, so it could potentially extend past that. But right now, any virtual visit cost sharing is waived, so all your copays are waived. In addition to UPMC Anywhere Care, they still have the 24/7 nurse line, Assist America if you're traveling outside of the country. If you're traveling outside of the UPMC service area, which is mostly Western Pennsylvania, if you're traveling outside of that area, then you will have access to any national chain pharmacy as well as any urgent care, as long as you're calling UPMC Health Plan and asking which urgent care you can physically go into if you're outside of Western PA. And then I like to highlight Life Solutions. So this is your employee assistance program. If you need any services, they have tons of options, and truly the best place to find all of this information, all the value-added services, is to go online in your own portal. They're all listed there. There's tons of wellness and coaching opportunities for you to talk with UPMC and see what is available. They'll create a nutrition plan, a weight loss program, smoking cessation program. Those are huge wellness options for you to take advantage and do some preventative measures in order to maintain your health and your wellness. So I'll stop there just to pause for the medical coverage to see if anybody has any questions. I know it was a lot of info. If no one has any questions, I'm just going to continue on to dental. Like I mentioned earlier, dental is changing from principal to UPMC. You'll want to check your provider, go online at upmchealthplan.com. Each person that is covered on the plan, UPMC will pay out $1,500 for the plan year. So April of 2021 until March of next year, $1,500 of claims will be paid with the exception of class 1. Class 1, any claim that happens in this first class, first is covered 100%, and second does not go towards this $1,500 maximum. When you get down to class 2 and class 3, there is a one-time deductible. For an individual, it's $50. For a family, it's a maximum of $150. And that applies one time to either class. In class 2, after that deductible, UPMC will pay 80% of your services with the discount for having the coverage. And then in class 3, UPMC will pay 50%, and then you'd be responsible for the other 50. There is no orthodontics covered under this plan, but again, $1,500 for any of your services, basically in class 2 or 3 would be covered. Vision is also going to be offered through UPMC, and the network is through NVA. You can also go on UPMC's website and find a provider right there or call member services. There is a frequency of every 12 months for everything that's included on the plan. So an exam, lenses, frames, or contact lenses. So you can get a full set of frames or contact lenses. You cannot get both in the same benefit period. So service, frequency of service really is every 12 months. So if you get your first exam and coverage for a full set of glasses on April 20th, you won't have coverage available for the following year until April 20th of 2022. So works a little bit differently than your medical coverage on that. If you're going to get an exam for frames and not contacts, they will charge $15 and everything else is covered 100%. Most of your lenses are covered at 100%. And then if you get any frames, they'll pay up to $150. You get anything over top of that $150, then they're going to give a discount of 20% on top of that. Again, if you're going to get contacts, it is very similar. They'll pay out $150, but the exam and a contact lens fitting is a little bit different. So they'll charge for a fitting of contacts. So a standard exam and lens fitting is covered at 100%. Majority of providers are going to charge over top of that. So if they have a specialty lens fitting, they'll cover up to $50, but that provider has the right, unfortunately, to charge you whatever their charge is. So they could charge $50 or they could charge $150. So just be cautious of that. I know it's caught me a couple of times, but UPMC is actually one of the few carriers that will cover medically necessary contact lenses. So if you have an extremely high prescription or you need it for a medical reason, that would be covered at 100%. They do have to send a pre-authorization, but UPMC is one of the few that would cover that. With vision coverage, you have a couple of other discounts and value-added services, and they'll cover LASIK. You will get a discount anywhere between 15 and 20%. There are 4 different providers with the LASIK, UPMC Eye Center, TLC Vision, QualSight, and LCA. And you can go online to find some of those providers or again, call member services. They have a discount program for their mail order contacts. And then they have a couple of discounts on anything extra on the actual lenses in your frame. So if you've ever gone to the doctors and they say, oh yeah, we'll make these thinner and we'll do the tinted lens and we'll do the gradient between progressive so there's no line on your lenses. They just give you a big fat invoice at the end of it and don't tell you what it's going to cost, but they have a fixed schedule from UPMC and this is what they will pay. I'm sorry, what you will pay, and there's no variance on that. So this is always good to take with you, and this is included on the benefit summary. If you go on Paylocity, you can actually go there, print it out, and take it with you. Any questions on dental and vision before I move on?
Is there a name for the dental plan? Because I just went to the dentist and they wanted to know what plan it was because there's certain UPMC they accept and certain ones they don't.
It's the UPMC, I believe it's the Advantage. I can just go back here.
Yeah, UPMC Dental Advantage.
Yep,
Thank you.
yep, absolutely. Don's Appliances provides an employer-paid life policy for every full-time employee. And they're going to provide a flat $10,000. You don't have to do anything to get this. It's guaranteed, but you do want to go online and elect a beneficiary, and you can change that beneficiary at any point in your life. So as things change, if you have a baby, you get married, you get divorced, you want to make sure that you're updating that at any time. And Don's is also offering the opportunity to purchase additional life insurance if that benefit is not enough for you. You can purchase additional life insurance in increments of 10,000 up to a max of 300,000, and it's guaranteed issued up to $150,000. So anything over 150, then you'll have to complete that evidence of insurability, and they'll require proof of good health. So they ask you some pretty general questions. If it gets further, they will request like a blood and urine exam, and they will come to your house or come to your work in order to get that completed. But anything $150,000 or under, if you're under the age of 70, is guaranteed issue. You would enroll on Paylocity. You don't have to complete anything else. You can also purchase for your spouse and or your child. And in order to purchase that for any dependent, you'd have to purchase it for yourself. So you just want to be cautious of that. Everybody that would get this voluntary life insurance has the opportunity to get an accelerated benefit, which means if you're diagnosed with a terminally ill diagnosis, you can take 75% of that benefit in advance of any event or claim. If you ever decide to leave Don's, you could take the policy with you. You could keep it as a term policy, or you convert it to a permanent policy. And just briefly, talking about spousal coverage or coverage for your child, you can purchase up to 100% for your spouse as you did for yourself. So if you elected 30,000, you could get no more than 30,000 for your spouse, and it's guaranteed. No questions, no medical questions asked up until 30,000 if you're under the age of 70 for your spouse. And up to $10,000 for your child. Your child doesn't have to complete any evidence of insurability. That's all just guaranteed, no matter what amount you would elect. And children are covered from 14 days of birth until age 26. Voluntary short-term disability is offered. You can purchase that on your own. There is a pre-existing condition clause for both short-term and long-term, which means 3 months prior, you can't be diagnosed, have seen a doctor, taken a prescription, anything for 3 months prior to purchasing coverage. If you do, you cannot get any benefits for that specific condition for 12 months after purchasing. So an example would be January, February, or March of 2021, you can't have any diagnosis, prescription, seen a doctor. That specific condition will not be covered from April 2021 until March of 2022. The benefit is 60% of your total weekly earnings up to $1,500 a week. That includes your base salary as well as commission and bonus, and that would be covered for approximately 3 months. If you want to, you can purchase both short-term and long-term. You don't have to purchase both. You can purchase one or the other. The voluntary long-term is nice in that you do not have to elect the full benefit of what your income is. So if you think it's too expensive, you can purchase half. You may not need the full benefit. So they do give you levels and increments to purchase voluntary long-term disability. If you didn't purchase the short term, this would not start until 90 days after your disability. So again, there is a waiting period on both of them. I believe I did not tell you on short term. It is 8 days from the date of your accident or illness. And long-term disability would be covered until your Social Security normal retirement age, or if you're after 65, there is a scaled increment on how long you would be covered for long-term disability. Voluntary accident is going to pay 24/7 on or off the job. And basically they pay you a lump sum regardless of any other coverage that you're getting. So if you have medical coverage, this will pay on top of that. They list specific things and they're going to give you a lump sum on what would be covered out of pocket, either open surgery, closed surgery, second degree or third degree in terms of burns or surgery. So again, it's just a specific scale, and I'll continue on to the second page so you can see what would be paid in a lump sum out of pocket. There is a wellness benefit of $50 for anyone that's included on the plan. So there's a wellness screening that's available. They give you a list of things that would be covered. Pretty simple process to file the claim for wellness, and you get your $50 check. So it could potentially just pay for itself. And the same with voluntary critical illness. So you're going to elect a specific lump sum that you would get paid out if any of these critical illness or cancer conditions would happen. So you can choose anywhere from $10,000 up to $40,000 for you, your spouse, or your kid. And they will pay for these specific conditions, whatever lump sum you would be electing. Again, as I mentioned, there is a $50 wellness screening for a list of items that you would be eligible for. Easy process to file that claim. You get a check in the mail, and pretty easy process. So lastly is the FSA. And again, I'll just stop. I'm talking a whole lot. So if anyone has questions. Okay. I'll just continue on here. So again, mentioning early on that the FSA is changing from task to Ameriflex. So you will get a new card, and there are a couple different dates, availability of funds that are going to happen throughout the year. And we'll update you throughout the year as those things happen. But one good thing came from COVID is that the IRS changed the rules on FSAs, that they're now allowing you to carry over all of your funds from last year to this year. So any healthcare FSA dollars that you have, any dependent care FSA dollars that you have are going to roll over. There's no maximum, they all are rolling over. And Nicole or Jolie could have, either one of them could have just sent you a letter, and they indicated what your balance is as of that date will be rolling over into the new plan year. So that will be available with Ameriflex after the plan has closed. And again, we'll update you on those, the timeline and those changes as things roll out throughout the year. So will be a lengthy process, but I believe with a lot of the challenges that people had with task, Ameriflex is going to provide a better solution for all the employees at Don's. So what is an FSA? If you're not currently on the plan, it's a tax-free account where you could put money into this account tax-free, on average about a 25% tax bracket. So money's going in tax-free, and you can pay for any qualified medical, dental, or vision expense that is going to be utilized throughout the plan year. So the maximum that you could put in is $2,750, and all of those funds in the healthcare FSA are available on day one. So if you put in $2,750 on April 1st, all of those funds are available. So if you need to pay for your kids' braces or you need to pay for your deductible, full amount is available on day one, but your payroll deductions will be coming out evenly throughout the plan year. So April until March of 2022. And this amount is in addition to what you are already getting if you're rolling over funds from last year to this year. If you or your spouse are enrolled in an HSA, you want to purchase or select the limited purpose FSA in Paylocity. And that would only allow for dental or vision reimbursements. There is a use it or lose it rule, and I know people have heard of this term, but again, this year because of COVID, they're not using or enforcing the use it or lose it rule. So all of your funds will roll over. We do believe that next plan year, that this rule will then be enforced again and this will apply. So March of 2022, only $550 will be rolling over to the plan year. So just be cautious of that whenever you're electing a specific amount on how much you're choosing this year, especially if you have funds rolling over from last year, even though those funds will always roll over. As it's explained here, you can have both. So you can have $1,000 rolling over from last year and still elect a new $2,750 for this year. And I'll just go back really quick. So some of the things that you can purchase on this FSA would be your deductible, your copays, your prescriptions, anything in dental that is not covered by the plan, anything in vision that's not covered by the plan. You can get contacts, glasses for you, your spouse, or your kids on the plan, even if they're not enrolled in John's Appliances Health Plan. So just be cautious of that. They just have to be a tax dependent of yours in order for you to pay for them on the FSA. Separate from the healthcare FSA, there is a dependent care FSA, and this one works a little bit differently. You can elect up to $5,000, and this one works a little bit differently where funds are not available on day one. It is what you have contributed over those payroll deductions that are available to you. So we like to call it money in, money out. So if you elect $5,000 and you're evenly distributing those over 26 pays, whatever that first pay is what is available to you immediately. So you can use it for any of these services as long as your child or your maybe even a parent or a grandparent is a tax dependent of yours. And they still have to qualify for all of the IRS criteria. They have to follow all of that. So I believe one of the biggest items is to have your own tax ID. So if you have a private sitter, that's fine as long as they have their own tax ID and they're within the IRS guidelines. In addition, here are some other criteria that the IRS regulates on eligibility for the dependent care. And I'll let you guys just take a look at that. I won't read through those, but there are several ways that you can get reimbursed for the dependent care FSA and the healthcare FSA. The easiest way is to have your card. You will be getting that card in the mail. You swipe it at the pharmacy, at the grocery store, at daycare. That's the easiest way. Or you can download the app. If you have a smartphone, you can download that app and take a picture of it, upload it almost immediately after the service. That's the easiest way. You can contact them by phone, you can email, mail, fax, or another easy way is to go on myameriflex.com and reimburse through the portal online. So tons of great opportunities to get tax-free expenses paid for with this FSA. And I can't say enough about it. I use my full benefit every year, and either contacts or glasses, it's great to pay for those additional benefits that you're paying a little bit out of pocket for. So I know this was pretty lengthy. Again, on Paylocity.com, you're going to find all of your benefit summaries and additional information, probably more than you need, but tons of information that's available at your fingertips. And also I'm available, and Don's HR team is also available if you guys have any questions. So I'll just pause there again if anyone has questions that they want to share with the group.
Just a few things that I'm going to put out there for everybody. Obviously, we've got 8 days left for this enrollment period. You do have to go in and elect and waive all of the benefits again. If you need help doing so, I sent a link to schedule a 15-minute meeting with myself, or you can contact Julie to set up a meeting. The most important thing is we want this closed as soon as possible because we have a lot of processing on the back end since we've changed carriers. So the sooner you make these elections, the better. And again, if there's any questions that you have specifically about your healthcare plans or anything like that, we are all very respective of the HIPAA laws, and your privacy is important to us. So call us and we'll go through your specific things individually. I think the most important thing about it is that this is the open enrollment period. So if you waive or do not do this election, you don't have health care for the upcoming year. So it's important that you make those selections. But we are here to answer all those tough questions. We have a few that were asked in the meeting on Tuesday that I'm going to put up a Q&A in community just so you guys can see the general questions that have come out in case you didn't even know that you should have asked that question. So I have had a couple emails this morning about the FSA, and certainly I'm going to put out some information on that. That is probably the biggest headache transition, but we will make sure that you know what's available to you effective April 1st. And then as soon as your tasks funds are available, we'll make sure that you receive that notification as well. So I appreciate everything that CSC and Kristen and Jennifer have done on the backside for this. And Julie and I are here for you through this whole process to make sure that you have what you need. But yes, even if you're electing the same healthcare as last year, you have to go in and re-elect it, which is your acknowledgement of our new rates for the new plan year. So other than that, if nobody has any questions, Kristen, if you want to close out with anything.
No, I think that is it. And thank you guys so much for sticking through that. I know it's a pretty dry topic, but try to make it as short as possible with the necessary information. But thank you guys so much for your time and have a great day.
You too. Thank you guys.
Thanks.
Kristen.
Thanks. See you guys.
Bye.
Bye.